What's up, guys? Welcome back to another episode of Survivor Bros. Well, your bros are out here trying to survive in the middle of the forest with hardly any modern conveniences. But we just built a filtration system, which means Cloyd is not as dehydrated this time.
I feel much better.
So now we're on the hunt to find some food, and we're gonna go hunting with our spears that we made. You ready, Cloyd?
Divide and conquer.
Yeah. I found our dinner. So, nice fat rabbit at 12 o'clock. Now, I gotta get up close and personal with this rabbit, so I obviously have to be as quiet as humanly possible. Come on. Come on, man, what happened?
I tripped and fell on my spear.
Oh. Well, it doesn't look that bad. Let's go back to camp and take care of it. Hey, ADAL, how do I treat a puncture wound?
Hi, Charlie.
Hi there.
I'm glad you asked the Academy of Doctors and Lawyers. You mind if we see the wound? Oh, good. That doesn't look too deep. Probably hurts pretty bad though, huh, Cloyd? Abrasions, lacerations, and puncture wounds are all different types of skin wounds. An abrasion is a medical term for what we would typically call a scrape. A laceration, a medical term for what we would typically call a cut. And a puncture wound is when you get stabbed by something.
I see.
Most abrasions simply need to be cleaned and covered. There's not a whole lot that we can do for these. Just keeping them clean and not letting them get infected is really the important thing. Treatment of a laceration depends on how deep the cut is. Remember, a Band-Aid really just covers the cut and keeps it clean and really keeps the blood off your clothes. Don't rely on a Band-Aid to stop bleeding. That requires direct pressure and elevation of the area that's cut. We take bleeding very seriously. If there is a large amount of bleeding, in an extremity especially, don't hesitate to use a commercial product like a tourniquet. These are available and should be in everybody's first aid kit. Slip them on the extremity, tighten them up, and twist this thing called a windlass on the outside of it. If it's still comfortable, you gotta twist more. Stopping the bleeding is one of the most important things you can do to preserve life in the case of a severe cut.
No kidding.
For treatment of a puncture wound, if the thing that has punctured has fallen out, just clean and cover the wound again. Control bleeding as necessary. If there's an object that's left in the skin, don't pull it out if it's deep. Just keep it in place, bandage around it, and seek medical attention.
Got it.
Don't forget to wear gloves and protect yourself whenever you are dealing with blood.
Thanks again for your help, Dr. Arze.
Yep, just keep doing that and you'll start to heal up pretty quickly. If you have any other questions, be sure to ask ADAL.
You're gonna be just fine, buddy.